Welcome to the Revita Health and Wellness Show. I'm your host, Francine Marie, and we're with Dr. Peter Fotinos today. How you doing?
Hello, how are you doing?
Good. We talked a lot about cortisol and the effects that it has on our body. Mm-hmm. Now, with thyroid and testosterone, we're working together with both of those, right?
Yes.
To get everything balanced out. If that doesn't work, what happens?
So if I can't get you fixed or get your stress under control and your cortisol under control with testosterone and thyroid, I have to deal with cortisol directly. So typically what that entails us doing is further testing, and further testing entails us doing saliva testing, okay? I'm not a proponent of saliva testing for checking other hormones out, because even though it gives you an accurate reading initially, it may not give you an accurate reading once you start hormones, okay? So the better way to do it is with blood work for the other hormones. But with cortisol, it's a little bit different. The reason why we do saliva testing for cortisol, there are studies that show it does well. It shows us how we're looking to see the cortisol levels and how they're working. And it's a very good way of doing that. The other thing is that would you rather have your blood taken 4 times in one day, or would you rather spit in a cup, small little cup, four times in one day? Most people will pick the latter. So it's a matter of convenience, okay? So I give you a kit. Basically, you'll spit in it 4 times in one day. You'll do it in the morning, noon, evening, and at bedtime. And what we're trying to do is kind of map what the cortisol is doing through the day. It's better than just doing one spot check of your cortisol with a blood test, because it has to depend on what time of day, but then you're not seeing the pattern, okay? Now, what I do is look at the pattern when the cortisol test comes back. And what you want to be is high in the morning and low in the evening. Cortisol is very important for sleep, okay? If cortisol wakes you up when it's high and puts you to bed when it's low. So and this is one of the ways I diagnose people with cortisol issues, is hey, are you waking up at around the same time every night at 3 a.m. or 2 a.m. or 3 a.m. and just wide awake, and your eyes are, you don't know why you're waking, or your mind's racing and you're having a hard time falling asleep? And if they answer yes to that, guess what? That's cortisol. So whenever you get a midnight or an after midnight peak in cortisol, you will wake up. And that's what happens with a lot of people who are under a lot of stress, or their cortisol is not being controlled correctly. Now, I told you I'm checking it throughout the day. Some people, I tell them, hey, when you wake up in the middle of the night, instead of doing that morning cortisol test, I want you to do it in that morning when you wake up, at the time you wake up. So we'll see, and we'll map it, see if there's that peak, okay? So what we're seeing is a pattern, okay? Now, if you're too high with cortisol, then we give you something to bring it down. If you're too low with cortisol, we give you cortisol to bring you up, okay? What medications do I use? Well, if you're too